Could you discuss a little bit about how you reverse a lot of your carotid plaque and your coronary calcium? You seem to have reversed that quite a bit. Um,
The simple story, I cheated.
as long as you get healthier.
Yeah, that's right. I get some that headline. That is by far my number one most popular video. I've had at this point like 1.2 million views on it,
Nice.
and it sounds almost like a clickbait title, and there is some component of that. It's like I reversed my plaque, my arterial plaque by 20 years, and it's true. Now. um, what then happens is I get a lot of hater responses and disappointment and frustration because I have to tell people, look, I'm 152, 153 right now. I was 160, 165 when that happened, or when I got that first CIMT, that to measure that plaque in my carotid artery. And so it's not like I've lost 30 pounds. It's not like I went from the standard American diet. I've practiced what I preached since 35 years ago when I was at Hopkins teaching preventive medicine. So, we didn't finish that part of the story. That there's no need to. I went on to run the program there at Hopkins. I taught docs there, and I've taught thousands of docs since then on prevention. So I was never a smoker. It wasn't because I gave up smoking. It wasn't because I lost 30 pounds. It was because I was getting insulin resistant and starting to lay down plaque. And
And you said you had some genetic predispositions also, right?
yeah, I've got. Are you familiar with 4q25?
No, I just saw you bring it up in the
Okay,
video.
4q25, fourth chromosome Q25 area. I'm homozygous for that. You know what homozygous means?
Yeah.
So that's the atrial fib gene. But if you remember the problems associated with atrial fib, it's also the stroke gene. Atrial fib is becoming more and more. Occult or undiscovered or paroxysmal atrial fib is becoming more and more recognized as the major cause for these strokes, most strokes that happen. I also have a healthy dose of 9p21, 9 meaning the ninth chromosome, and the p21 being the p21 area on that chromosome. That started off being the cancer gene. There were a couple of cancers like colon cancer that were originally associated with that gene. Then they went on to find a few years later it was associated with heart attack and stroke. Then they went on to find a few years after that it was really more associated with adult onset or type 2 diabetes than anything else. And I've got a healthy dose of that. Originally, we thought it was 1 or 2 SNPs. You're familiar with the term SNP?
Yeah.
And now there are upwards of 24 different SNPs that are clearly implicated in terms of 9p21. So you really, it's sort of oversimplified to say, well, I've got 9p21. The question is, how much of it do you have?
Okay.
And I've got a healthy dose of that. So anyhow, the bottom line is I practiced what I'd preached forever. I was mostly plant-based. I'd always kept my BMI never over 25, always in that healthy range. But yet I had plaque at 57. In fact, I had plaque by CIMT, arterial age of 74 years old.
Jeez.
And before I had those, I thought, I expected to do a victory lap, and that was obviously not what I did after I heard the results.
Yeah,
That
you
actually
had isn't the normal a normal CIMT score, it's around like 0.6 to 0.9, and you had like a 1.2, I think I saw in the video.
Yeah, 0.65 is usually considered the cut point for the amount of plaque between the intima lining, where the glycocalyx is, and the media, the muscle part, the structural component of the artery. that experience actually was a major part of what gave birth to the channel. I learned a lot of that stuff at what's called a Bale-Donine course. They get into a lot of the technical, very test-oriented aspects of heart attack and prevention. It was $2,500 just for a weekend, part of that training course. And my perspective was, you know what? A lot of this is all publicly available science. And although it's somewhat technical, this is information that the public would need to have. And it might be somewhat geeky, but you know what? I bet there'll be some people that are interested. Anyhow, back to how I cheated to decrease that plaque. Bottom line was, I finally bit the bullet and decided to take a statin. I do think that I took Crestor, low dose Crestor, 5 milligrams a day, and then switched down to 2.5 milligrams a couple of times a week. And I did. I added a little bit more salmon. A year or two later, I cut my carbs out. I was not as aware of the impact of carbs at that point in time. I did lose another, 10 pounds, 165 down to about 155.
Okay.
That sounds like it's just an adjustment, but 10 pounds for a 155 pound or 160 pound person is like 7% of your body weight.
Yeah.
And
you're also taking niacin, right?
Yep, I started niacin from the very beginning.
Okay.
So those were the things that I did. And again, because I mentioned statins especially, the world is full of statin haters. And, but the reality is the reality. That's what I think was one of the top 2 or 3 things that helped me reverse that plaque. I get a lot of haters for it. Now, another place where you could criticize it is a well-known fact that CIMT, carotid intima media thickness test, it's an ultrasound, and it's known to suffer from reliability. So you could say, well, you just got a bad test. You got a bad test in the beginning, and you got maybe overly good tests in the end. That's not really true. At that point in time, I started using that a lot. So I was getting these things like every month or two. And you saw a very, very reliable and clear curve. And it was real.
Okay.
I have gone up and down. I got totally involved in some other prevention work with a large Medicare Advantage group. I was the science officer for about 800 docs, and I had to travel a lot. When I travel, sometimes I eat too much, and I got up to about 163, 165. My IMT got back up to about an arterial age of about 57, 56. It's back down to 54. Those are really probably not significant variations.
Okay. I highly recommend everyone check out your website. It's prevmevheartrisk.com. You have a lot of great information, and you even have a $30 course, the Cardiovascular Inflammation course. Could you discuss a little bit about that for people that would be interested in taking that course?
Sure, thanks. And it's PrevMed, but most people don't remember PrevMed. They just remember my name, Ford like the car, Brewer like Milwaukee, and Brewer.
I'll leave a link in the description for everyone to check that out.
And the course is the basics. Here was one of the other ideas. Brad Bale and Amy Duneen and do their own version of an extremely high level preventive evaluation for people. And I did that for a few years. It was $5,000 just to, and that didn't include the labs. You go to some of the places in California, like the California Life Extension Institute, and it's like $10,000 to $20,000, and that's, again, doesn't involve any follow-up. So I wanted to develop. I've got a passion still for developing something. I come from public health roots. So I'm looking to provide a similar type of evaluation and experience for people that can't afford their own airplane.
Yeah.
And that's what this is all about. So I'm developing in a consecutive course format the ability to get all of this for much less expensive. In fact, all of the information involved is on the channel there for free now, totally free. But the problem is, as you said, there's 550 videos out there, and you'd have to be, I did them, and I can't keep up with, what topics are covered when. So what we're doing is a sequential course perspective. So we've done the first thing to look for is cardiovascular inflammation. Then the second thing to look for is what's the cause of cardiovascular inflammation? And I've developed that course right now. My team is working on polishing it up. On the inflammation course, you can do the whole thing. There's about half a dozen videos and some text along with it. And you can cover the whole thing in about 2 hours. It tells you how to get testing, which tests to get, and how to interpret them. So there's another new activity going on in medicine. It's going to change the way medicine is practiced, and it's called patient-directed care. So you look at the Harvards and the Stanfords and some of the other big names, forward-thinking names in medicine. We're trying to get away from this paternalistic thing, and I've hated paternalism from day one. I've felt like I grew up with too much maternalism in the environment, in the culture that I grew up in. So I tend to consult with patients, not try to give them orders on what to do. And that is where medicine's going. So what I'm creating here is a way for someone to do patient-directed care, to do begin their own evaluation, learn the information they need to learn to go through. Do I have cardiovascular inflammation? Well, if I do I have, or whether I do or not, what is my situation with the number one most common cause of cardiovascular inflammation? Glucose metabolism problems. Okay, do I have Lp(a) problems? Do I have lipid problems? And so I'm going to be knocking each one of these topics off to create a full consensus of courses. Another way you can do this is we have like boot camps. We've had a couple of them in Orlando called the Healthy Life Summit. I've got another one coming up November, I think 8th and 9th here in Louisville at the University of Louisville Conference Center. And it'll be like 2 days of intense topics, things you might find on the YouTube channel, however, all focused on a systematic approach to the critical question for baby boomers. Do I have plaque? Do I have cardiovascular inflammation? Do I have the problems where am I in terms of the number one cause of cardiovascular inflammation? And then what do I do about it?
Yeah, it's really great that we have technology now that 10 years ago, you'd never guess that you'd have as great of a doctor as you on someone's computer, that's as easy as, watching TV. That's really amazing. Can we go back to metformin? So do you predict that in the near future, if we see metformin go through this FDA trial, the TAME trial, and successfully, and then over the future see similar mimetics, do you think doctors will be prescribing a drug for that, like every 6-year-old would be taking?
I think we're way beyond. I think prescribing this for 6-year-olds is just not real. I'll be dead. You may actually be dead by the time that happens. But I do think that my prediction is the metformin will work. And I also predict it'll probably take at least 5 to 10 years for the political system in our culture to acknowledge that. Yeah. Say, look, the benefit is far worse than cost or risk associated with this, and we do need to start recommending it. I'm guessing maybe 10 years and metformin will become a standard part of medical recommendations. But that would still be at age 65. if you look at other people, and I agree with him, I disagree with probably everybody on some points, but I agree with him a lot of what David Sinclair talks about. I mean, he started taking metformin in his late 40s, I think.
Yeah.
And when I have patients that come to me that are interested in it, and I'm totally open and comfortable in providing that. That's one of the services I provide, even for 40-year-olds, because you've got a lot of 40-year-olds. 40s, especially with the obesity epidemic, the 40s is becoming much more of a time when this insulin resistance is starting.
Okay. Yeah. And you wanted to discuss transhumanism a little bit,
I
right?
did. So you called me and mentioned my channel and talked about interviewing, and so I took a quick look at your channel and some of the. When I Googled your name, I got the Transhumanism
Yeah.
video, and that sounded kind of weird, I have to admit. So then I watched a few of the videos. The videos really didn't sound that weird. It sounded like what you're about, and that is taking some very cutting edge and maybe beyond the bleeding edge technology that's out there to extend healthy human life.
Yeah.
So that part I got. There were still a couple of things that I still didn't quite get. One of them was to call it a party sounds like it's a political movement. And are there political movements? Do you guys have a candidate or something?
Yeah, we're an established political party. Well, I used to be the secretary of the United States Transhumanist Party, and yeah, it's an established political party, just like the Democratic Party or Republican Party or the being an independent. And there's somebody who ran for presidency in 2016 named Zoltan Estefan, and
Didn't win.
I think someone's running for presidency in 2020. And of course, being anything but a Democrat or Republican, you have just about no chance of becoming a U.S. president. But it was a way to get out information to try to push the movement of extending healthy lifespans, and along with transhumanists are a really big supporter of merging yourself with technology, kind of like becoming like a cyborg. And so yeah, transhumanism, it's kind of like the words transcend and humanism mixed together, and so it's a real focus on advocating for science technology, especially radical science and technology, and with another focus on extending lifespan for hundreds of years, really. And there's from my research, there seems to be two methods of doing this. There's one method would be general medicine curing biological diseases, and then the second method would be to transfer your consciousness. And I'm not sure if transferring your consciousness into a computer would even be possible. There's some compelling evidence out there that is possible, and I mean, at the end of the day, we are mechanical systems, but that would require like way more understanding in neurology and neuroengineering, and so even if that did become possible, I would advocate for people to wait a couple hundred years to study that issue.
Sounds like a good movie, though.
Yeah, yeah, there have been some movies on that.
I know. I haven't seen them, but I've seen
Yeah,
the trailers.
one of the most compelling arguments for transferring consciousness is the fact that transistors are doubling on an integrated circuit. Well, not necessarily that. You may have heard of Moore's law and how computer growth is doubling every year and a half. And a lot of computer scientists will say that that Moore's law is slowing down and about to end, which is true. But if you look at the history of computing, Moore's law is only one aspect of the history of computing. There's been four other technologies that computer growth has been based on. And so once Moore's law ends, what's likely going to happen is, like that's happened four other times in history, is that a new technology is going to continue computer growth.
Right.
And so there's a lot of experts who say if this exponential growth of computing continues to happen, we'll have human level artificial general intelligence, which essentially you have like a robot that can do everything a human can do in like the 2000 around 2030. And then supposedly there's an implication that in the late 2030s, you'll be able to transfer your consciousness because you'll have the same computing power of the brain. And so a lot of that is explained by a man named Ray Kurzweil, who's the chief scientist, chief operating, the chief scientist of machine learning at Google.
Very interesting.
Yeah, he's made a bunch of predictions, but with biological diseases, I mean, you see, if aging is cured in the near future, which there's a few promising methods right now, which we've discussed, the various drugs like metformin, and they're coming out with various mimetics, and there's even a study of using AI to find better mimetics. They have gene therapies extending lifespans in mice, and I have a video where I discuss where stem cells are applied to treat a myriad of diseases lately. I recommend people start their search at a clinic that's been becoming more popular lately in Panama called the Stem Cell Institute, ran by Dr. Neil Reardon. He's treating and getting some like great results with mesenchymal stem cells. He's essentially infusing them. I mean, that's one of his main methods to treat like a myriad of diseases. But sadly, like what you said, we start seeing people jump the gun, and they establish a bunch of treatment centers in the U.S. and a bunch of people are doing this now. They're infusing mesenchymal stem cells into United States citizens when there's not FDA approval yet. And the worst thing is I see people like chiropractors, places that are owned by a chiropractor. They just have a nurse IV the mesenchymal stem cells when it's like you should really at least have a doctor there to administer it and check out the research. So yeah, that's too bad. But so we have these promising drugs and gene therapy, stem cell therapies. Martine Rothblatt of the United Therapeutics, she said that her company will provide xenotransplantation to the masses, which is where they're specifically genetically modifying pig organs to be more like human organs, because they recently used CRISPR to get rid of all the retroviruses inside the pig's genome, so that the organs can be, and they placed human genes inside the organs. So they have these like the human organs inside pigs, and they're just going to harvest these pigs and provide masses of organs. And so if you have artificial general intelligence, and we already have AI diagnosing better than doctors. I'll provide a bunch of the links in the description.
I'm actually working with a group that's doing that. K Health. You may not have seen my videos. I did a couple of videos on K Health. K is in the letter K.
Okay.
And yeah, you're exactly right. The machine logic is now being applied and does a much better job of diagnosing than humans. Now, it's not going to get rid of doctors, but I mean, it's just like who was it? Gary Kasparov back in the 90s. He did a Google talk and he said, "Look, I was the guy that handed over the reins from a human brain for playing chess to." It's a machine now. It'll never reverse again. Machines are far better, and they're clearly better at going back and thinking about the tens of thousands of things that could be causing a certain symptom in a certain human being. So docs that are not using that kind of AI logic and experience are not going to perform as well. There's no question.
And that's still 10 years away from the prediction of when human level AGI will occur. So those are a few compelling reasons for why people think that in the next 20, 30 years that we'll actually be able to cure all biological diseases because of this convergence of these age-versatile drugs and gene therapies and stem cell therapies and artificial intelligence. That's a big aspect of what transhumanism really is.
It's interesting. Speaking of the cyborg thing, that was another thing that I took a look at that. I saw you've got a section of guys that are doing some sort of I think transplanting headphones into their ears or something like that. And I thought, man, that's a little bit weird.
Yeah, no.
No, it's interesting though. And then I don't have one on today, but one of my more common things to do for my videos is to raise my arm and show my continuous glucose monitoring button. And I do recommend that somebody wears one of those, especially once they get middle aged, once they start realizing they have glucose metabolism problems, they need to know where their glucose is. And I mean, we are already starting to tiptoe into the cyborg age, whether we want to acknowledge it or not.
Yeah, you see brain-computer interface technologies, a real technology in which you can invasively implant electrodes inside people's brains, and the people can move around robot arms just by thinking about it.
Yep.
And so the merging of biology with technology is clearly possible, and you don't have to. It's not even invasive anymore. Now they can move robot arms with just an EEG.
Right.
And you see a bunch of companies like Neuralink and Brian Johnson's Kernel. You see quite a bit of money being spent on this issue, and the prediction for when you can actually transfer your consciousness is in the late 2030s. So the fact that we're seeing so much money being poured into it right now, maybe that's a hint for where the future will go. But I don't know. Yeah, it's a big topic, and I try not to stick to implanting like headphones in people's heads. That's a little I think unnecessary. I think it's better to focus on things that are more important, like curing Parkinson's with merging some piece of technology, and fixing spinal cords, and being able to help people get out of what's that called when people are in a coma, but they're still awake. I don't know, whatever. But that's all the questions I had for you, Dr. Brewer.
Well, Bobby, it's been fun.
Yeah.
I really enjoyed it.
Thanks a lot. Do you think we can do another video a year from now and get an update on your video channel?
Sure, that'd be great. I'd love to.
Okay, awesome. Okay, have a nice day.
Okay, you too. Bye-bye.